Hello everyone, I'm Sarah Prime, the Fetal Wellbeing Lead Midwife.
I'm Becca Long, the Clinical Skills Facilitator.
I'm Frankie Head, Practice Development Midwife.
This is part of your mandatory training. Please ensure that you've watched this video prior to attending the Fetal Monitoring Day.
As part of your mandatory training, we've developed a medical devices self-assessment document. This will be explained more during your live webinar, which is part of your Master Month. But part of that document there is a CTG self-assessment form, and what we want you to do is fill that in once you've watched this video and take it with you to your fetal monitoring day.
During this video we're going to go through the 3 different CTG machines that we use here at East Surrey Hospital and the different features within them. Before commencing the CTG, it's important to consider the whole clinical picture and make sure that you have a clear clinical indication for use. You can refer to the antenatal and interpartum CTG guidelines, and it's also essential that women in established labour have an onset of labour fetal monitoring risk assessment completed, and this is in their notes. It's important that you visually inspect the CTG machine to check that it's clean and that there's no obvious issues with it that would make it unsafe to use. We should be cleaning the CTG machines using our standard Clinell wipes before and after use. And when using them, it's important that we use ultrasound gel.
When the red line appears, the paper needs changing. In order to do that, release the tray. Please ensure that the new paper is the right way up, noting the number at the bottom of the page. This is important because otherwise the CTG will record upside down. There are many components to your clinical assessment, but it's important to identify the vital things you must do prior to starting the CTG. Firstly, ensure the mother's bladder is empty. You've performed an abdominal palpation in order to place the transducer in the correct place. And it's mandated nationally that you must listen to the fetal heart using the pin-on stethoscope or the sonic aid prior to starting the CTG. And by doing that, you differentiate the maternal pulse from the fetal heart. The maternal pulse should be taken manually and should be documented on the CTG. This is important because the machine can pick up maternal pulse, double the rate, and then that can look like the fetal heart, and you can be measuring the maternal pulse erroneously.
So we're going to set up dose regimen. So we go to setup, antepartum analysis, and then we need to turn our analysis on. So we can see that it says analysis on, and then it says please enter gestation. So we need to enter the gestation. We can change the weeks. So you can see it's coming up 30, and then we can change the smaller weeks, so 31, 32, 33, and then we can add days as well, because obviously that needs to be accurate. And then once it's done, we press exit. It says analysis is on. It says the gestation there. We exit, and then the analysis will be on. So when the dose regimen is set up, this is what it looks like on screen.
To set up dose regimen on this machine, go to Settings, Analysis Settings, and select dose regimen. Click the tick to accept it, click the X to close the settings box, and there dose regimen. Now it's telling me it's not in progress because I haven't entered the details I need to set the dose regimen up. So I gently press and hold the screen there, and I enter my patient data. So it's asking for name, I use a pseudonym, the patient ID, so the hospital number. It is a little bit sensitive, this screen, and the gestation. To select the gestation, it's really important this is accurate. You can do it by the LMP, the gestational age, or the estimated due date. It's important that you check that on the scans and with the woman. So we'll say that this is 39 weeks and 3 days. I've used the gestational age to change it there, and then I would always check with the ladies your due date the 18th of February 2022, and 39 plus 3 shows there. You click the X to accept that, and then the tick to accept that, and the tick to accept that, and as you can see there, my dose regimen is no longer saying no. And then to start it, we're going to press and hold the printer button. And green means it's printing, so it's recording our trace and printing it out for us. And the dose regimen is a purpley mauve lilac colour. When the Dawes Redmond is met, that will go green.
These machines are used on Rustboard and in Andu, and to turn them on you must switch on this switch at the back. Once the machine's switched on, you can attach the CTG as normal and then press the print button. Once you do that, the machine will beep because it wants you to enter the gestational information in order to start the Dawes Redmond analysis. You have a choice of weeks here, so we're going to press 3 for 30 weeks, and then you can add the number of weeks. So in this case we're going to press our 5 to 9 button and choose 9, and we're going to say choose 39 weeks, press next, and it will ask you, is this correct? If it's not, you can re-enter. If it is, you accept, and then the Dawes Redmond analysis will start. So prior to setting off your printer, please make sure you go to Setup, go to Twins Offset button, and make sure that the function is on, and then press Exit. And you have ultrasound 1, ultrasound 2. Please make sure that ultrasound 1 is for twin 1, ultrasound 2 is for twin 2. To switch between the audios, you will see there's a speaker at the top. If you press this button here, then it will switch to ultrasound 2. Just be mindful that you can always only hear one baby on audio, but both babies' heart rates will be on the trace. Once you've set up the twins offset, both fetal heart rate recordings will appear. Twin 2 will be offset by 20 beats per minute, meaning that when you interpret the trace, the baseline will be 20 beats below how it's recorded.
So to set up twins, obviously we'd have 2 fetal heart rates recording. Make sure you've got fetal heart rate 1 and fetal heart rate 2. And to set up the twins offset, we click on the settings, we go to trace offset, and then we click on FHR2 plus 20 beats per minute offset. Make sure there's a tick in that box, and then we press the tick there and the X, and that should be set up for us. And to change the audio on the twins, simply press which audio you want, and we can switch it from one to the other.
To switch to an FSC, you need to unplug the abdominal transducer, ultrasound 1, for a singleton, and plug in your FSC lead. You've got a white casing there to go in your white port there, and that's really important, and you might need to switch the audio over, or it might do it automatically. In the case of twins, in which you would have twin 2 and twin 1 plugged in, you'd be placing an FSC on twin 1, so you would unplug the transducer for ultrasound 1 and replace with the FSC that you've placed on that baby's head.
To use the FSC on this machine, just like the other machine, you must take out ultrasound 1 first before you plug in your FSC lead. On this machine, it's green to the green port. To make annotations on this machine, you use the button with the pencil at the bottom, and you have some options that you can use. To annotate the trace, you press this pencil icon, and you have a number of things that you can choose, including position change, membranes rupture, or other reason, or you can custom and add your annotation manually.
So all CTG machines have the ability to have a fetal monitoring button included. So this isn't really necessary for labour, but all antenatal CTGs must have the fetal monitoring button attached and in use. So when you're starting an antenatal CTG, it's of vital importance that you instruct the woman that whenever she feels a fetal movement, that she gives the button a press. And what will happen is that will register on the CTG machine and on the CTG trace. If this is not in use, it will affect the Dawes Redmond analysis, and as a result it may lead to the criteria not meeting as quickly as it would.
During the video there were 8 different changes. Did you spot them? Please jot them down because we're going to be discussing them on the fetal monitoring day. It's to demonstrate the importance of situational awareness.
Now that you've watched the video, please remember to fill in your self-assessment form regarding CTG, which is included in your medical devices document, which will be sent out to you all.
Thank you for watching. We really hope you enjoyed this video.